Hello and welcome to Cindershadow Gaming. I am your host Cindershadow, and yeah, I just need your guys' help. Well, today I got a letter, and it's something that's got me completely worried. It's, I went up and down. Do I make this video? Do I not? There is a lot of things wrong with what's going on here in Alberta. We have stuff going on. Obviously, we have the world event that is not making things easy for anyone. And because the world event is going on, we got vaccines. These vaccines are doing wonders in the world and progressing and opening up things. I'm seeing restrictions getting lifted here and there everywhere. And that is great. It's great to see the sense of the world getting back to normal. However, during this time, the Alberta government actually put forward a decision somewhere around December. December 12th, I believe, was what the day. Yeah, December 12th is the article that I have here that I will read to you guys in a minute. As most of you know, I have ulcerative colitis. It's a incurable disease. It's one that can be placed in remission, much like similar cancers and stuff like that. It's unlike cancer where it grows throughout the body and stuff like that. Ulcerative colitis really affects the colon, and it really makes it very difficult to do a day-to-day task when you're in the middle of what's called a flare-up, and that's where your body is just rejecting everything, and you're either bleeding from the insides out, or you just can't hold anything in your stomach for very long, 20 minutes at max, and you've got to go on like a liquid diet. I suffered from these effects since I was at least, I want to say 13, going back quite a ways, where I had what was described as juvenile arthritis, when in purposes it was improper nutrition because my body didn't digest food. I just went through years and painful years until I was the age of 30 without being diagnosed. And then at 30 I got diagnosed. Talking with my doctor and getting things settled and good, we started a treatment plan, and that treatment plan kind of worked, but it didn't put me in a good place. And it wasn't until about 4 or 5 years ago that I was placed on Humira. This was after looking at other meds that were out there. There was other meds that I could have gone on. One being Imuran, but Imuran had a likelihood of not working and a very high chance of making things actually worse. So to me, I just never did that. I didn't want to take that step. I didn't feel safe going on that medication. I felt it was not something that was safe, where in this case, I went on Humira because it was something that had a tried and true response and history behind the medication. There's been a long-term process with it. It's been on the market for over 20 years, just not used as much for like my disease. It was originally a rheumatoid arthritis medicine that they found other uses for it, and those other uses have done quite well ultimately. And ultimately, when it comes down to digestive, it's kind of all the similar things. Now, the thing with Humira is it's a biological drug, so it's an altered. Unlike where you have a medicine like acetaminophen or Tylenol or aspirin, you can make a generic form of it. And what has happened here is now they're on the market over the last few years, about 5 years, there's been approvals slowly coming through for what's called a biosimilar. These biosimilars are not identical to what these medications are. They are like a step removed. If you look at like the periodic table of elements, you put like Humira on it, and then you go one direction to the side, and you actually get what's considered a biosimilar. So it's similar in the way that they share the same sort of atoms and everything like that, but it has a completely different property and a completely different reaction to the immune system in this case. And this is playing around with my immune system, and in all intents and purposes, it's not something I traveled or dabbled in very lightly when I had to make the choice of prescriptions and doing something going forward. And today I got a letter from my coverage. My coverage is actually paid for by the makers of Humira because it is quite a costly drug. One shot, I believe a package of 2 shots is something like $1,600, which comes out to about $800. That's Canadian. That is my understanding of it. Those prices may fluctuate depending on where you are in the world. Now, the letter I got here today is to advise me that the coverage for biological drugs on the government-sponsored plans that may affect your prescription of Humira. On December 12, 2019, the Alberta government introduced the Alberta Biosimilars Initiative. These are new drugs. These are not something that tried and true and tested. The Alberta Biosimilars Initiative aims to expand the use of lower-cost biosimilars on government-sponsored drug programs. Savings from the initiative will be reinvested into the health system. The changes associated with the Alberta Biosimilars Initiative affect originator biologic medications and their biosimilar versions. The first version of biological drug is called the originator or reference biological drug. A biosimilar drug is a biologic drug that is very similar to but less expensive than the originator drug, a biologic drug. Health Canada says that patients and healthcare professionals can have confidence that biosimilars are effective and safe for each of their authorized health conditions. Tests are done to help ensure that there is no expected differences in how the drug works, and the safety of the biosimilar is compared to the originator biologic medication. Adult patients currently taking the originator biologic drug Humira for ankylosing spondylitis, hydradescentis, Crohn's disease, plague pylorus, arthritis, rheumatoid arthritis, and ulcerative colitis, which includes me, will be required to switch to a biosimilar version by May 1st, 2022. To maintain coverage through their Alberta government-sponsored plan, if this change applies to you, your health professional will be discussing this transition with you and will provide you with new prescription. As part of the change, you may join new patient support program. Your healthcare professional can contact the appropriate patient, yada, yada, yada. The major problem I have with this is I cannot afford this coverage. I have double coverage. I have my work coverage and Blue Cross coverage. My Blue Cross coverage is covered by Humira. By them saying I have to go to a biosimilar, I now lose the coverage from Humira. Thus, I lose the coverage from Blue Cross. It completely goes away. I cannot afford it. It is approximately, it's like $150 a month extra on top of everything else I am paying. It is absolutely ridiculous that I have to go through this, and I was grateful to be on the dual coverage through my supplier, through Humira themselves. My work benefits only cover 1 shot a month, and I've been getting another shot a month through Blue Cross, and the other 2 have been supplied by the company. I can't continue like that. I cannot turn around and put more money towards a extra coverage that I already have to deal with, and it's really unfortunate that the Alberta government has turned around and done this. I had there was some talk about it a while ago with the Globe and Mail. It was in an article in the Globe and Mail about this back on December 12th when this was announced, and my understanding at the time when I read it, I was like, okay, this isn't really going to affect me because I'm already on the meds, and it sounds like there isn't anything that is suitable to turn around and do with. So this Globe and Mail article, Alberta will force patients to switch from biologics to cheaper biosimilar medications. And I just got to say, a biosimilar is not the same thing. It's not like a generic drug. Generic drugs are identical in circumstance. A biosimilar is not. They're a new technology that is untested. It's unproven in the world, and there is a lot of stuff behind it that just does not add up. Alberta will force 26,000 patients on government-sponsored drug plans to switch from expensive drugs that are known as biologics to cheaper, near copies of the medications, a move that will save the province hundreds of millions of dollars in the coming years. This is incorrect. This will not save you money. This will not do anything of the sort. By switching this and contemplating the risk of 26,000 people in this province, you are now pushing people onto a drug that is unproven, and even though you guys are saying it's safe, there isn't science to back that up yet. There isn't anything saying that it's going to work the same way. There is a ton of fear behind this, and rightfully so. Like I said, I took a long time to research Humira and to really read into it and to see if it was something that was an option, and it was. It wasn't an experimental drug, much like we have with the emergency use vaccine that we have right now with COVID. That is a completely different scenario. This is something that is not tested. It's not proven to me that it's going to do the job that it should do. And in all honesty, if this doesn't do the same job, it's going to put me into a flare, it's going to take me out of remission, and it's going to place me on disability, and I don't want that. I want to be able to work. I want to be able to live my life. I want to see my kid grow up. I don't want to have to sit there and turn around and get a section of my colon cut out. I don't want to sit there and get cancer because I let this thing get out of control. That is the fears that I have here. And this is why I do not believe a biosimilar drug is going to make things better for me. I believe it's going to worsen my quality of life. And that is why I am making this video. It is a very tough world already. And I am thankful that I can sit there and work and be able to earn myself a place in society, and not being able to go forward and have coverage like this makes things even more fearful for me. Things are already very tight as it is, and I'm already dealing with a lot of other stuff with the 3 years that I was away from work. We're catching up very slowly, and unfortunately I don't know if that catch up will actually happen. I've got other stresses in the world that other than this. And this is something that honestly I can sit there and talk about and say, this is not right. This needs to be fixed. And there is stuff going on here. The major policy change in favor of less expensive versions called biosimilars will take effect next summer and is expected to save $227 million to $380 million over the next 4 years. I don't believe that's the case, because there is a lot of things going on with biosimilars. They're now skyrocketing in price. We're seeing insulin for people with diabetes go through the roof on top of that. And it's the same sort of scenario. These drugs cannot be substituted. A biosimilar, to me, is a no-go. It's not something that I trust yet. Alberta will become the second province after British Columbia to stop covering some of the brand name biologic drugs that have driven significant increases in prescription drugs spending across the country. When you have a new drug on the market, usually you can make a generic version of it. That generic version has to be done 7 years after the original production of the drug. That's why we have Tylenol is acetaminophen. It's the exact same thing ultimately, and it's just dependent on what they do for additives in that will either slow or progress the progress of what the painkiller actually does. But the provincial government intends to go even further than BC, including more drugs in the first phase of its plan, introducing the tiered framework that will limit drug choices for patients with rheumatoid arthritis, Crohn's disease, who are starting biologics for the first time. I am not starting biologics for the first time. I have been on it for years. And now I am getting a letter stating I have to go and come off of it and go on to something else that I don't know will work. We are expanding the biosimilars initiative to make sure that our drug programs in Alberta are going to be sustainable. Alberta Health Minister Tyler Shandro needs to be ousted from office immediately. He has been nothing but a plague on the system. He does nothing but fight with doctors and does everything in his power to drive the healthcare system in this province down. It's not what we need here. The government is working to rein in Alberta health spending more broadly, an effort that has already drawn the ire of healthcare workers, unions, and Alberta Medical Association. Where am I? I lost it. The province initiative likely to earn plaudits from those who see promoting the less expensive medications as a sensible way to free up money for other healthcare priorities. This doesn't solve issues. This doesn't do anything. All this does is push the issue further down the line. You push it to this next drug that costs 15% less. And then what? In 5 more years, you're going to push it to another drug that costs 15% less. This is not solving the issue. My med needs to be funded. I need to be able to stay on this med, and that's the whole purpose of this. There is no reason to switch me off this, and it can cause detrimental side effects that will make my quality of life worse. However, some gastroenterologists, patient advocate groups, including Crohn's and Colitis Canada, Gets Gutsy is their tagline on Twitter, have expressed concern that inflammatory bowel disease patients forced to switch won't do as well on cheaper drugs. This is the worry here. Health Canada and drug regulators around the world say biosimilars are safe and effective as the original drugs they mimic. They're not the same drug. Mimicking I've spoken at lengths with my doctor, and there was talk that I might try and go and try marijuana for my disease as part of it. And what I got from it was it wouldn't necessarily alleviate the problems that it is. It will mask the problems with it and may mimic the problems here and mimic going forward and a treatment. It doesn't necessarily take it away. So, and that's part of the reason why I don't do a lot of other drugs. It's why I don't go that route. It's something that, in all honesty, would just mask the problem and wouldn't actually solve the problem. Where right now with Humira, I have a stable, I have a stable health right now, and I don't want that to go away. Biologicals are complex medications produced from living organisms and injected or infused into patients. They have dramatically improved the health of people with debilitating diseases such as rheumatoid arthritis, Crohn's disease, chronic illness for those who used to be few good treatment options. In Alberta, government spending on biologics skyrocketed to $238 million in 2018-2019, up from $21 million a decade earlier. 4 of the top 5 drugs in term with public spending in Alberta are biologics. At the top of the list is Remicade, which is another version of this drug. However, Remicade, I have to, if I was to go into Remicade, I have to sit there in a hospital every couple months for 3 to 4 hours getting an infusion. That to me, that doesn't seem practical for living. I'm in the trades. I'm trying to avoid being on disability because of this. This is not going forward. It's an intravenous infusion for the same thing, which cost the provincial government as much as $91.2 million last year, more than any other single drug. Crohn's disease and ulcerative colitis have no cure. They also don't quite understand where how the symptoms surface in the first place. They don't quite know where they came from. They mostly affect people in first world nations. In a third world country, you don't actually hear of these problems. There's something different going on there, and I'm not entirely sure with it. I have a direct bloodline down to Napoleon Bonaparte of France, and he actually suffered from Crohn's disease. You see pictures of him holding his stomach, and they believe that he actually had Crohn's disease, and that could be one of the reasons why I have what I have and where it's gone down to. And it's not something that is I'd ever thought that would come to surface this many years later. He even had a bloody handkerchief from coughing up blood constantly from the Crohn's disease, and that is something that is very fearful. Thankfully, I am on the ulcerative colitis side, which is still just as serious, but it doesn't affect the entire body in that sense. So they have the list price of Remicade at $962 a vial, while biosimilar versions sell for $525 to $493. We're talking a discount, almost half off. But once again, that isn't going to turn this price down. This doesn't get rid of the price. They're looking to save a few dollars, and they're picking on 26,000 patients here. 26,000 patients that are in needing this critical care. We're trying to live the same way as everyone else and have the ability to do that, and we can't do that if the government is going to push us down and keep pushing us down. It doesn't move forward. Biosimilars are like almost like generics. No, they're not. They are cheaper, near copies of original biological drugs whose patents have expired. However, biologics, unlike simple chemical pills, can't be replicated perfectly from batch to batch, even within the same brand. So I have a better chance of sticking with Humira just because, yes, things do fluctuate a little bit when they're making it, but they're using a tried formula that has that degree of separation and that degree of failure and going forward. My God. That complexity has allowed some opponents to argue that biosimilars aren't as safe or effective as original biologics, especially for patients who are being asked to switch for financial instead of health reasons, and that is the case here. However, my financial scenario is now, if I can't stay on Humira, I lose all coverage, and I have no drug coverage, and I have no biologic that I can take. Down at the bottom here, yeah, the changes are expected to affect 22,000 Albertans with diabetes, 2,000 with Crohn's disease or ulcerative colitis, 1,400 rheumatoid diseases, 750 with multiple sclerosis, 450 with low white blood cell counts, and 35 with plaque psoriasis. The changes will kick in July 1st, 2020, do not apply to patients with private insurance or patients who pay out of pocket for their prescription drugs. Children and pregnant women will be exempt. Physicians who believe there is a medical reason why the patient should not switch will be allowed to apply for the province for an exemption. This letter says otherwise. For patients on Crohn's disease, rheumatoid arthritis, and related rheumatoid diseases who are either starting biologics for the first time or switching away from a biologic that has stopped working and tried a new tiered framework means they will have to try cheaper biologics options first. I am not new. I have been on this for 4 to 5 years. It's not something very well. And, you know, GI Society, Canada Society of Intestinal Research, I just want to point out they've got a thing here from Health Canada. What is Health Canada saying? Health Canada does not consider biosimilars to be identical or bioequivalencies to the originator reference biologic and states that biosimilars are not the same as generic drugs like the article just stated. However, approved biosimilars are safe, effective, and highly similar to the reference originator biologic, and there is no clinically meaningful differences in safety and efficiency between them in patients newly started on biologic therapy. So people that have been on this for a while now are being forced to switch. New patients going on to a new drug, that makes sense to me if you want to move that forward. But I've been on this now for 4 to 5 years. Health Canada recommends that any decision to switch a patient from an originator biologic drug to a biosimilar should be made by the physician in a consulting with their patient, taking into account the clinical evidence available as well as any prescribing policies in relevant jurisdiction. And instead, they've changed the policy in my jurisdiction to say that I have to come off this and go on to a biosimilar, which I will not be able to get covered. Anyway, guys, I don't know what to do. I am at the point where I am very frustrated. I've been contacting people all day. I've contacted my doctor. They told me to talk to the makers of Humira. But to me right now, I have contacted them. I'm waiting for response. And right now I'm at the point where I don't know which direction to go. The extra coverage, this is extra coverage. And at this point, if I go get extra coverage, I would need to get 2 to 3 more times coverage than just this at this point. It's not a simple, oh, I can pay the $150 a month. I don't even have that right now. It's something that should not be. And, you know, we kind of take things for granted with our taxes here that do pay for a lot of the healthcare, but here in Alberta, things are not good. Things have gone off the wayside, and now I'm being directly affected by it. Anyway, guys, thanks for watching. I hope you guys share this out with anyone you can. Maybe write into one of the MLAs here in Alberta, because something needs to change, and this is not right. This is I don't know where to turn. I really don't. Thanks for watching. Have yourselves a great day.